Today, the most important day in the journey of Smiles. It started in 2010 from the land of Mandya. It's in the old Mysore region, and this is our third branch in the last 9 years. We started in Mandya in 2010 and worked with the rural masses for about 5 years. In 2014, we started a center in Bangalore, and since then we have treated more than 2 lakh patients and about 18,000 surgical procedures, and we have been able to give best clinical outcomes in the last 9 years. So Smiles International Institute of Protology. So we are a research institute, and we will bring in the best practices across the globe and make sure that the clinical outcomes are excellent. So basically, Colo is a branch which deals with the part of the lower GI system. The lower GI, which includes the cecum, the ascending colon, the transverse colon, the descending colon, the sigmoid, rectum, and the anal colon. About 50% of the problems are in the lower GI. Today in India, about 36% of India's population suffer from different kind of colon, rectal, and anus problems, and the numbers are increasing in size due to lifestyle changes in the recent times. And about 50% of the population, at least, suffer once in their lifetime. About 15% of India's population suffer from constipation. Constipation you can see right from infancy to old age. There are various causes of constipation. So the problem is plenty because people are shy. It is stigmatized, some kind of social taboo. People have fear of surgeries. There are a lot of myths running around colorectal problems, and people suffer in silence for decades before they seek a healthcare provider. Even after getting into the big problem, they don't seek the healthcare provided proper. Majority of the population in the country, they go to quacks, right from the educated to the business, the industry, the cinema, the bureaucrats. Most of the people go to quacks because of these problems for the simple reason that they have some shies, they have some kind of taboo, and these quacks, it's a big problem in the country. There are about 1.5 million quacks operating in this country across the length and breadth of the nation, which is published in European journals. And these quacks make patients' life miserable. Patients go with pain, and they exploit the situation by giving different kinds of treatment which are not scientific, which are not evidence-based, which has no relevance to the particular problem. And many people have committed suicide after going to quacks. Quacks put some kind of acids, they cut their sphincters, they don't know where to operate, what to operate. Many people got infected and they become they've gone for septicemia, and badly people have lost their lives. So this is one major challenge to deal with colorectal problems. And second thing is women in this country. Women in this country, even today, 52.1% of India's population, they defecate in open air. Especially women, when they defecate in open air, either it is before sunrise or after sunset. So in between, they suppress the act of defecation. So this is one of the reasons for constipation and then landing up in fissures and piles. So one way to avoid colorectal problems in women in rural areas is to use toilets. So using toilets is very, very important, because in the toilet, which is a closed space where there is no fear, people can defecate freely and they will completely vacate the bowel and come out. Women during pregnancy also suffer these problems, and they don't share because of shyness and taboo, stigma attached to these problems. So now this recent job profiles, the IT professionals, the garment industry, the drivers, people who sit for a long time. So all these people are prone to colorectal problems. So along with this, changing food habits, changing eating habits, changing lifestyles, sedentary lifestyles, not taking enough water, not taking enough fiber. So all this will add to the size of the problems. So we have in the last 9 years of our journey in the Mandya region, we have covered about 6 districts: Mysore, Chamarajanagar, Mandya, Hassan, Tumkur, and Bangalore rural. We have covered 26 lakh families. We have gone to doorstep, and we have brought awareness among the masses. So we have partnered with Dan Foundation through Equitable Healthcare Access Consortium. So we are the founding members of the one of the founding members of the Equitable Healthcare Access Consortium. So driven by D.V. Shadri from Indian School of Business, and we have Aravind Eye Care, L.V. Prasad Institute, and Fernandez Hospital. So these leading institutions have come together and from the EHC consortium. So through this consortium, Dan Foundation is also one of the active members. So through them we have reached families in this old Mysore region. So in future, in the coming days, we had a discussion with Niti Ayog Vice Chairperson Dr. Rajiv Kumar last week, and we wanted Government of India to make Colo Rental as a national program where they bring in awareness among the masses right from school days, doing intervention right at the school days, make it as a policy on lifestyle, awareness, promotion of good health. To know more about SMILE's International Institute of Colo Protology and colon health, please visit our website www.siicp.com, and you can write to info@siicp.com.